Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, chronic kidney disease, also called chronic kidney failure, involves a gradual loss of kidney function. Your kidneys filter waste and excess fluids from your blood, which are then removed in your urine. Advanced chronic kidney diseases can cause dangerous levels of fluid, electrocycles and waste of build-up in your body. So to discuss on this, we are being joined today Dr. Dhruvajyoti Choudhury, consultant nephrologist. So not to waste any more time, I'll straight away move to the doctor to talk more on the topic which we have taken today. All right, thank you so much, Dr. Dhruvajyoti Choudhury, for joining to Good Life, the health show today. And today the topic which we have taken is chronic kidney disease. So at first, if we would like to know that what do we understand with chronic kidney disease, what would be that?
Yeah. Hello, Pooja, and very good afternoon to you and all our esteemed viewers at this point of time. I'm here to today discuss something about chronic kidney disease. But before we go into discussing the disease per se, we should know that the kidneys we have are vital organs of ours, and it is doing a number of important functions. It is responsible for filtering your blood, it is maintaining your bone health, it is maintaining the acid and base balance, it is also maintaining the fluid balance in the body. And you see, all these functions the kidney is doing very silently 24/7. So what actually happens in chronic kidney disease, that there is a gradual loss of these functions which we have just stated over a period of months to years, and a point reach where the patient develops complications or symptoms of the disease per se. He gradually develops swelling of the legs, he may develop decrease in appetite, he may develop breathing difficulties, and all these symptoms and many so. A very important thing to understand at this point of time, that this process of gradual loss of kidney function is a silent process. It is a progressive process and it is an irreversible process. And the importance of my pointing these three distinct features of this disease is that this disease is so silent that everything is happening unknowing by the patient. And by the time the patient comes to us, the disease has even reached a very advanced stage where, most of the intervention of the present medical field is not enough to save the patient's life.
All right, so this is just an idea about what exactly is a chronic kidney disease, and we will be having discussion in our entire episode. But viewers, the numbers are flashed on your television screens, and if you have any queries regarding the topic which we are discussing at this point in time, please call up and ask your question, as Dr. Dhruvajyoti Choudhury is with us at this point in time, and hopefully he will be giving you all the answers. All right, doctor, now if we talk about the chronic kidney disease, why is it so prevalent? What is the reason behind it?
Yeah, Pooja, this problem, chronic kidney disease, or CKD as we tell it, is a very common problem which we see in our day-to-day practice. And maybe one important cause of chronic kidney disease, maybe as we are getting old, maybe our kidneys are also getting old. So to tell you a fact, by the age of 40, everybody of us, we start losing our kidney function at a rate of 1% per year.
Okay.
So if you start losing your kidney function at the age of 40, so by the age of 60, I believe every one of us would be in some form of chronic kidney disease. I think that is one of the reasons. As you grow old, your kidneys also grow old. Another possibility is that maybe when we were born, we were not born with a very good healthy kidneys since childhood. So few of us, maybe from our birth itself, we had a low kidney mass, we had a aplastic kidney or a dysplastic kidney, and we are at more risk of developing chronic kidney disease in adulthood. Another possibility is that maybe as we grow along, we might have some diseases which are not chronic, but they are acute kidney disease. And we might be having these diseases at regular intervals, maybe because of some wrong drugs, maybe because of some infection in the kidneys, or maybe some inflammatory disease of the kidney. So eventually these episodes of acute kidney insult, they also progressively lead to CKD.
Right,
but
so
to tell you the fact, the most common...
Yes, please.
Yeah, these are some of the possibilities. But if you ask me what is the most common cause of chronic kidney disease, it's diabetes. Not only in India, worldwide. Other than that, blood pressure is also a very important and a neglected cause.
All right. All right, doctor, we'll come back to
Yes,
that, but we have a caller at this point in
Yeah.
time. Let's take the call and then we'll proceed with the conversation. Hello.
হেল্ল' মই আপোনালোকৰ অনুষ্ঠানটো চাই আছোঁ মই গণেশগুৰিৰ পৰা কৈছোঁ মই জানিব বিচাৰিছিলোঁ কেনেকুৱা বহুতে কয় যে কিছুমান মেডিচিন দীঘলীয়া দিনৰ কাৰণে মানে লং পিৰিয়ডৰ কাৰণে আমি লৈ থাকোঁ তেতিয়াহ'লে কিডনীত ইফেক্ট কৰে এতিয়া কেনেকুৱা ধৰণৰ মেডিচিনবিলাকে কিডনীত সাধাৰণতে ইফেক্ট কৰে যিকোনো বয়সৰ মানুহৰ বিষয়ে সুধিছোঁ এতিয়া ধৰক কিছুমান মানুহে নিউৰৰ কিছুমান মেডিচিন লৈ থাকিবলগীয়া হৈ যায় দীঘলীয়া টাইম পিৰিয়ডৰ কাৰণে তেনেকুৱা ধৰণৰ কিছুমান কথা আছে নেকি কিডনীটো ভালে ৰখাৰ জানিব বিচাৰিছিলোঁ সেইবাবে মানে ফোনটো কৰিছোঁ
Hello.
Yes, yeah, you can reply, doctor.
নমস্কাৰ বাইদেউ আপোনাৰ যোনটো প্ৰশ্ন খুব গুৰুত্বপূৰ্ণ প্ৰশ্ন আৰু আপুনিতো জানি আচৰিত হ'ব কি ড্ৰাগছ আৰ আ ভেৰি ইম্পৰ্টেণ্ট কজ অফ কিডনি ইঞ্জুৰি ড্ৰাগছ আৰ ভেৰি কমন আপুনি যদি মোক সোধে কি কোনটো ঔষধৰে খুব বেছি দিগদাৰী পেইন কিলাৰ্ছ আৰ ওৱান অফ দি নাম্বাৰ ওৱান ড্ৰাগছ দেট ইজ এভেইলেবল ৱাইডলি এণ্ড দে আৰ ইমপ্লিকেটেড ইন কিডনি ইঞ্জুৰিজ তাৰে বাহিৰে আপোনাৰ এণ্টিবায়'টিক্স থাকে এণ্টিবায়'টিক্সেও কেতিয়াবা আপোনাৰ ইউজ কৰিলে কিডনিত অসুবিধা কৰিব পাৰে তাৰে বাহিৰে আপোনাৰ কিছুমান ঔষধ থাকে যেনেকৈ আপোনাৰ পেণ্ট্ৰপ্ৰজল অমেপ্ৰেজল এইবিলাক প্ৰটন পাম্প ইনহিবিটৰ গ্ৰুপত পৰে আজিকালি ষ্টাডিজে কৈছে কি এইবিলাকো যদি আপুনি লং টাইমলৈ লয় তেতিয়া আপোনাৰ কিডনিত আঘাত হ'ব পাৰে চ' আই থিংক দিজ আৰ দি থ্ৰী ইম্পৰ্টেণ্ট ড্ৰাগছ দেট আৰ ইজিলি এভেইলেবল এণ্ড ৱাইডলি বিং ইউজড এণ্ড প্ৰেছক্ৰাইবড দেট হেভ ডাইৰেক্ট ৰিলেশ্যনশ্বিপ টু kidney injury.
Okay. All right. Thank you so much for calling at this point in time. I'm sure the answer which just doctor gave must be benefited for you. All right, doctor, you were talking about sugar and blood pressure, one of the major causes. So can we say that if you control your blood pressure and sugar, so you can get rid of these chronic diseases?
Pooja, just before moving to the next question,
Okay.
one important point in the causes of chronic kidney disease, I would like to point, especially in our Indian subcontinent, the second most very important cause of chronic kidney disease in India is CKD-U. And the U stands for unknown. Nobody knows why it's happening.
Okay.
But the research has been going on and there are a number of publications that have given us some hint. They are telling that, increased exposure to heat and dehydration, the people being exposed to environmental toxins and industrial contaminants, and the practice of widespread use of indigenous herbal medications. These are actually putting a lot of burden to the patients in India and causing kidney disease. That was something I wanted to point out.
Okay.
And coming to your question that if we can control blood pressure and diabetes, can we prevent or retard the progression?
Right.
I wish it was true, but you see, things are not that simple. If you speak of hypertension, the effect is very linear. So if you can control your blood pressures, you are most likely to prevent developing chronic kidney disease and may even help to retard the progression. But not in case of diabetes, because in diabetes, because of genetic predisposition, and a lot of existing comorbidities a diabetic patient has. A diabetic patient has high lipids. A diabetic patient might have a non-alcoholic fatty liver disease. A diabetic person may have a coronary artery disease. So all these factors, they have a negative impact on the kidneys also. And so the cause and effect is not linear.
Okay.
So what I mean to say that in diabetics, even if the person thinks that murto sugar control to bhal and my sugars are very well, still, in spite of doing a very intensive sugar control, the patient may and actually eventually develop chronic kidney disease.
Okay. All right. So these are some of the points one has to get to understand about it, that one should be not sure that if we control our blood pressure or sugar, we will be preventing it, isn't it? Now, a certain age group is also being detected. Now, if we talk about the age group, which age group are we talking about in certain, there's a chronic kidney disease? What do you have to say, doctor?
The chronic kidney disease as a disease per se is widely distributed in all age groups.
Okay.
You'll be surprised to see in our clinical practice, we even see, age group at the age of 5 years, the children are coming with chronic kidney disease. However, the reasons are not diabetes and blood pressure. And even at the age of 65, 40, 30. So you pick up any one of the decays and you can have a patient of chronic kidney disease.
All right, all right. So this is the age group. So we can't actually ascertain which age group are we talking about. Now, doctor, if we say that one has to understand about the kidney problem, so can anyone feel that one has a kidney problem, and how to know that? What would be the process to know that?
Pooja, see, I have already told you that the whole process of this gradual loss of kidney function is a very silent process.
Okay.
So kidney disease per se is a very silent disease, and I know that is the most scary part, and that is the most worrisome part. And the symptoms the patient present, they are very non-specific, and they are very subtle symptoms. You may not pay attention to them most of the time. But if you ask me that, sir,
so can we say that it is difficult to diagnose kidney problems?
I'm coming to that, Pooja, but there are certain specific pointers whereby the patient may get alarmed. Okay, fine. If I have this symptom, I might see my kidneys. A very important symptoms are passage of foamy urine.
Okay.
Patient is passing foamy urine. Patient has passed blood in the urine. Patient is complaining of pain in his bilateral or unilateral flanks. The patient has a recent detection of blood pressure, often neglected. Because many of time, if you are detected to be hypertensive, you just keep on taking drugs. But, very few people that think that the cause of hypertension may be a kidney disease. These are certain very specific pointers.
All right.
Having said that, I would also like to tell you that in spite of these specific pointers, many a time in clinical practice, we see patients that the patient has reached a very advanced level of renal failure, and he never had any of these symptoms any time in his life. That is the most scary part.
Okay.
We are so worried about that. Yeah.
All right, doctor, we have a caller at this point in time. Let's take the call. Hello.
Yeah.
Hello.
Hello. আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব।
আচ্ছা, এই না এটো কি টিকেটৰ লগত কথা পাতিব নোৱাৰিম নেকি?
পাৰিব ডক্টৰৰ লগত পাৰিব কথা পাতিবলৈ আপোনাৰ প্ৰশ্নটো কৰি লওক তেওঁ শুনি আছে আপোনাক।
মই তাৰমানে বিপিটো মোৰ খুবেই বেছি, মই ঔষধ খাই থাকো, কিন্তু আপোনাৰ চিমটম কিন্তু একো নাথাকে মোৰ। আৰু কিডনিত এফেক্ট কৰিব পাৰে নেকি? আৰু কিডনিত এফেক্ট কৰিলে চিমটমটো কি?
নমস্কাৰ বাইদেউ।
হয় কওকচোন।
মই আপোনাৰ মানে ব্লাড প্ৰেছাৰ আৰু আপোনাৰ কিডনিৰ ৰিলেশ্যনশ্বিপটো খুব ক্ল'জ। তাহাঁতৰ কজ আৰু ইফেক্ট ৰিলেশ্যনশ্বিপ আছে। মানে ব্লাড প্ৰেছাৰ হোৱাৰ কাৰণে কিডনিৰ বেমাৰ হয়, আৰু কিডনিৰ অসুবিধাত মানুহৰ ব্লাড প্ৰেছাৰ বাঢ়ে। চ' দে আৰ ইণ্টাৰ ৰিলেটেড। আমাৰ নেফ্ৰলজি ফৰামত আমি যেতিয়াই মানুহ এজন ব্লাড প্ৰেছাৰ লৈ আহে, আমাৰ এইটো দায়িত্ব হয়, আৰু আমি বিচাৰোঁ কি আমি মানুহজনৰ আণ্ডাৰলাইং কিবা কিডনি বেমাৰ আছে নাই আমি চাব খোজোঁ। কিয়কি আমি যদি নাচাওঁ আৰু আমি মানুহজনৰ ব্লাড প্ৰেছাৰজন বাকী মানুহৰ জেনেৰেল পপুলেশ্যনত যোনটো 80-90% মানুহৰ যোনটো ব্লাড প্ৰেছাৰ থাকে, সেইটো ফালে যদি চিকিৎসাটো দি থাকোঁ, আৰু ধৰক আমি সেই মুহূৰ্তত এইটো নাচাওঁ কি মানুহজনৰ কিডনিৰ প্ৰব্লেম হৈছে, তেতিয়া কি হ'ব, যেতিয়ালৈ আপোনাৰ চাইন এণ্ড চিমটমছ আহিব, আপোনাৰ অসুবিধা হ'ব, তেতিয়া ডিজিজটো বহুত প্ৰগ্ৰেছ কৰি যায়। তেতিয়া আপুনি দৰকাৰী যিমানখিনি ট্ৰিটমেণ্ট ষ্ট্ৰেটেজিজ আছে সেইখিনি কৰি সিমানটা লাভ নাপায়।
All right. Yeah, please, আপুনি সুধিব পাৰে।
কিডনি প্ৰব্লেম থাকিলে আপোনাৰ চিমটমটো কি হয়?
কিডনি প্ৰব্লেম বাইদেউ চিমটমছবিলাক একদম নন স্পেচিফিক। বহুত ক্ষেত্ৰততো ইটছ এ ভেৰি চাইলেণ্ট ডিজিজ। আপুনি গমেই নাপাব কিডনিৰ অসুবিধা হ'ল কেতিয়া, ৰিপৰ্ট কৰিলেহে গম পায়। কিন্তু মই যেনেকৈ আপোনাক ক'লোঁ, কিছুমান স্পেচিফিক চিমটমছ আছে যোনবিলাক দেখিলে বা কাৰোবাৰ পৰা শুনিলে মানুহে ভাবিব লাগে কি মই এবাৰ মোৰ কিডনিটো চেক কৰিব লাগে। নাম্বাৰ 1 চিমটম হৈছে পেচাব কৰোঁতে বেছি ফেন উঠা। পেচাব কৰোঁতে যদি আপোনাৰ কেতিয়াবা ব্লাড গৈছে। এটা আৰু ইম্পৰ্টেণ্ট চিমটম হৈছে আপোনাৰ যদি হঠাৎ কিডনিৰ জেগাত বিষ হৈছে, বিষ অনুভূতি। কেতিয়াবা যদি আপুনি শুই উঠি দেখিছে আপোনাৰ মুখখন ফুলিছে, আপোনাৰ ভৰি ফুলিছে, দেখিলে লাগে কি খুব সৰু চিমটম, কিন্তু আমাৰ কাৰণে খুব স্পেচিফিক চিমটম। কেতিয়াবা যদি আপুনি খোজকাঢ়োতে উশাহৰ কষ্ট পাইছে, চ' এইবিলাক আপোনাৰ খুব স্পেচিফিক চিমটমছ কিডনি বেমাৰ।
All right. Thank you so much for calling at this point in time. All right, doctor, we'll proceed with the conversation, but right now we'll have to slip into a short break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we're having a fruitful discussion with Dr. Dhruvajyoti Choudhury, consultant nephrologist. All right, doctor, coming back to you again. Now, I was asking you, is it difficult to diagnose a kidney problem? So what do you have to say on that?
The answer is actually, Pooja, yes or no. It depends.
Okay.
In the early stages, it's very difficult to diagnose chronic kidney disease. Even I might miss, even though I see patients regularly. But as the disease progresses and the symptoms become more clear, diagnosis become quite easy.
Oh.
And I think the key to diagnosis is to have a high suspicion.
Okay.
You need to screen patients and you need to do tests. And you'll be surprised to know there are just two tests you need to do to diagnose chronic kidney disease. One is a blood test,
Okay.
where you do a serum creatinine value, and one is a routine urine test, where you look for passage of protein in the urine. And this creatinine test is available all over the world, in any of the labs at a mere cost of 200 to 300 rupees. And just by doing these two tests, you can have a diagnosis.
Okay.
What I personally think that the idea should be to exclude CKD, not to diagnose CKD. Because only when you have this approach of excluding the diagnosis, then only you will be doing these tests and you will be picking up the patients very early at their disease, that is the time when all the strategies we have at present works.
All right, so the blood test which you are talking about is the basic one, so one can do it. So do you suggest the ones who have a confusion among themselves that maybe or might be they might have a kidney problem?
Yes.
So if confusion needs to be cleared out, so this blood test is recommended.
Yes. You just do two tests.
Okay.
You do a serum creatinine and you do a routine urine test. It will cost you 350, 400 rupees. And you are so sure.
Then they can proceed with the other things and all, and they can see a nephrologist to get themselves cleared about their confusion. Now, doctor, now if we talk about the treatment procedure, so can it be treated and how to manage kidney diseases?
You see, Pooja, like all the chronic diseases, it's not a curable disease. But yes, we have some treatment protocols, we have some treatment strategies being laid down. A very important treatment strategy in managing kidney patients, chronic kidney disease patient, is fluid restriction. We advise them to limit their daily fluid intake.
Okay.
We advise them to limit their salt intake. We advise them to moderate their protein consumption. We advise them to take a diet, that is less in phosphorus and that is less in potassium. So what I am actually telling you, a plant-based vegan diet is supposed to be a very good form of diet for chronic kidney disease patient. Well said, but in this part of the country might be difficult because we are all by birth we are taking non-veg, so it's very difficult to switch over. But a single thing that can help you is a vegan diet, plant-based vegan diet.
Absolutely, doctor. Every good health leads to a good diet as well, and also our physical activity, how we are living our lifestyle, which has changed a lot these days. Now, doctor, like if we talk about the ones who are suffering from CKD, that is chronic kidney disease, so do all the patients of CKD need a dialysis? What do you have to say?
Yeah, you see, CKD has got a number of stages. From the day of diagnosis till you progress to a stage where a doctor is advising you about dialysis and transplant. Once a doctor is advising about dialysis and transplant, that is end-stage renal disease. So your disease has progressed to a stage where if you do not take any renal support, which might be a transplant or a dialysis, you are unlikely to survive. Not everybody requires dialysis, you require dialysis in kidney patients only when the disease is end stage. Many of our patients, even when they have not yet reached the end stage, they may die, they may succumb to a stroke, they may succumb to a cardiovascular accident, they may succumb to infection. That is also to be taken care of. But, dialysis and transplant are well-proven modality for treatment of CKD. And dialysis has been around for now 50 years, It's supposed to be the oldest treatment modality available and it is maintaining people's life. But, there is a public fear, there is an inhibition regarding dialysis.
Yeah. Now, doctor, your comments on the COVID care for CKD patients, what would be that?
COVID care, the hot topic, everybody is facing.
Absolutely.
I don't think anybody is left out. Any piece of land in the world is left out of COVID infection. Few things are very important. Specifically for kidney patients, because they are high risk. They are the susceptible one. They have increased chance of infection. The disease can be very severe in them. They should not take it lightly. They should always be using the protocols. We are all now used to the COVID protocols. Even though many of us may not be using it, I please ask them to use it, COVID protocols, to maintain COVID protocols. Patient say they should not miss their dialysis schedule because of COVID, and they should be vaccinated. The vaccine is actually helping, I think, at least in India, I think. So they should have double vaccination. So these are a few things I think I'd like to comment on COVID care in chronic kidney disease patient.
All right, Doctor, now we are really short of time. So what would you like to tell our viewers that how to take care of their kidney? What would be your message to them?
Yeah, I'd like to tell you the old saying, prevention is better than cure. So if you ask me about the preventive strategies, there are very few, but they are very worthy strategies. Please, don't get dehydrated. Keep yourself well hydrated.
Okay.
I'm not telling you to take, these carbonated drinks, or, these days there are mineral water infused or vitamins and etc. I'm asking you to take plain water. At least take, 8 to 12 glasses of water per day. You should also try to restrict the use of this fast food culture that has propped up in our cities,
Right.
Because there is the concept of saturated fats, and there is a concept of hidden salt. It's not the common salt that is the white in color that we use.
Okay.
They've got high amount of salt that would ultimately lead to hypertension. You can prevent this.
Okay.
And please avoid taking over-the-counter drugs. Please consult your doctor before taking any drugs, because it may harm your kidney.
Absolutely. Thank you so much for these wonderful messages. I'm sure the viewers who have watched our show must be benefited with all the answers and all the messages which you have just given. Thank you so much, Doctor, for joining to Goodlife, the health show. And
Thank you, Pooja.
Viewers, thank you so much. Viewers, with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. And keep watching Northeast Live. Goodbye.